No cycle monitoring, no injections.
No injections.
You just have to take a couple of pills.
Yeah, I've started antibiotics today.
And
drink lots of Gatorade. The doctor told me the other day, I don't eat McDonald's, but the doctor told me that I should go and have some McDonald's fries. I need to have a very high sodium diet for the next little while, which is ridiculous because I have more of a sugar tooth than anything. So, yeah, it's going to be interesting. What else was I going to say? I'm nervous about the egg retrieval. I think the things that I'm most nervous about are I had a bad experience getting an IV when I was 11, and I'm sort of nervous about getting the IV, but not that bad. I've just become a pincushion. I have a big Sharps container of all the needles that I've injected.
Not even all
of them, because I've been having some at the clinic. So, and it's like a good old musical rattle right now. There's so many empty needles in there. So I'm a little nervous about, but not even about the IV. Mostly I'm nervous about the drugs. I'm worried about how I'm going to feel on them. I often have bad reactions to drugs, so I'm worried that I'm going to have a panic attack or something.
It'll be twilight sedation, so it's something, it's fentanyl and then something that's like Versed or
yeah, it's kind of like a
that.
morphine.
Yeah, she said one's for the pain and one's so you forget everything.
Yeah. And I just keep telling, I met the nurse that's going to be sedating me, and I just keep telling her, bring on the drugs. I want to be out. I don't want to remember anything. I don't want to feel anything. I want to be out. So, hopefully that'll be the case, and I'll be totally out.
Yeah.
So, what's going on with you?
Not actually that much. I feel like I've been a little just in a holding pattern, as they keep saying. I've been on the estrase, which is the estrogen, for I think 2 or 3 weeks now, I guess. I am, along with baby aspirin every day. My linings last time they checked, which was just about a week ago, it was at 12 millimeters, which is more than enough, apparently. And I went for acupuncture last week, and I'm going to have another appointment this week. They say, it's a good idea to start as early as possible, but I was feeling unsure about it. But I thought I would give it a try, and not that I'm afraid of it or anything, I just wasn't sure if I wanted to do it. Yeah, I am. And, but it was fine, it went well. She gave me some things to do at home to help increase blood flow to that area, including pinching on my femoral arteries, which is really neat. I'm supposed to do that to Shannon as well, but she refuses. Yeah. And, yeah, I'm just really excited. I mean, right now it's all her, and
you're going to start your progesterone injections. You have to start
Wednesday
those the day of my retrieval. You're also on the antibiotics.
Yeah, which is interesting, I guess, because it's bad if I get an infection and give it to you or something. And then the transfer will be either Saturday or Monday, depending on how the embryos do.
Yeah, hopefully it'll be a 5-day blastocyst transfer.
The doctor said she's aiming for a blastocyst transfer, but we don't really know.
Yeah. It's like today. Like today, I thought in the morning, oh, okay, Wednesday is going to be my retrieval day, and then it was it's Thursday, and then in the afternoon, it was nope, you got to come back to the clinic. It's Wednesday, so you really kind of get in this holding pattern, and it's hard, right?
Yeah.
Because we're not telling our workplaces. We have friends that know at work, but we're not telling everybody at work, so people are just sort of what is going on with you? You're saying you're having surgery, but your surgery date keeps flip-flopping, and you're coming in every day having coming in late because you've been at the doctor.
What they think.
Yeah, I'd be really interested to take a poll right now and ask people what do you think is going on? Because it's pretty shady.
I think it would, in hindsight, it probably would have been useful to take off, this week for you.
Yeah, if I could have.
Yeah.
Just because I've been...
It is very involved.
Yeah. And I've been uncomfortable, and the tech, one of the the ultrasound text the other day was really great and really kind of hit the nail on the head about the way that I've been feeling. She asked me how how are you doing? How have you been feeling? Like, have you been feeling really moody? And I'm just like, yeah, absolutely. Lots of ups and downs. And she just basically turned around and turned to Allison and said, that's not Shannon right now, right? Like, that's not her. Those are the drugs. And like, these drugs make women feel crazy. And it's so true. Like, I just don't feel like myself. Like, I feel like I'm sitting on the inside kind of at times just watching myself go. I'm extremely tired. I'm napping in the afternoons. I'm just not myself at all. But I'm trying to stay really mellow. And yeah, I'm having weird mood swings. And
it's an intense time.
Yeah, but I've got some supportive people around me that are being really great and will listen and aren't judging me for being kind of grumpy. And so, yeah, things are going well.
Yeah.
We'll have another update in a few more days. But other than that, I think that's pretty much everything.
Yes.
Been a really busy time, and we're excited. We're excited for all of this. I'm excited to get my mind and my body back, and not be so kind of induced by drugs. And we're excited to get some good news about hopefully the embryo, one single embryo implanting. Even though we're doing a 2 embryo transfer, we're hoping for one implantation.
Yes. Okay.
Everything done?
Nope.
Okay. Thanks for listening.